Hello, my name is Allie Hecht,
And my name is Alexa Cotton.
and today we'll be discussing the statistical methods used in the article Fractal Temporal Organization of Motricity is Altered in Major Depression from the Journal of Psychiatry Research.
The paper aims to quantify the differences in the patterns of hand motor activity in depressed people. The movements, similar to gait, show a fractal pattern, meaning that previous movements affect the subsequent movements in a pattern. When studying human gait, researchers have found that one stride is influenced by previous strides, in which the effect of a single stride decreases over time. Additionally, this pattern is evident no matter the time scale analyzed. When humans time their strides to a metronome, however, this fractal pattern is not observable.
This study aims to determine if depressed subjects express altered patterns of hand motor activity when compared to healthy subjects. The study included 10 healthy and 10 depressed, unmedicated, age-matched patients. The activity and range of motion of both their left and right hand were measured between 10 a.m. and 4 p.m. The researchers performed detrended fluctuation analysis, or DFA, to determine a single fractal scaling component, alpha, that represents the fractal fluctuation observed in the movement. An alpha value of 1 indicates that the pattern is fractal. An alpha value between 0.5, the minimum, and 1 indicates a random series, like white noise. And an alpha value above 1 indicates smoother patterns with less complexity.
In this discussion, I will be acting as the author of the paper.
And I'll be acting as the critic of the paper.
So as the author, I believe that a between-group parametric student test was appropriately used to analyze the demographics of the two groups and establish that they were two groups which were demographically similar and only differ in terms of depression. The Mann-Whitney or Wilcoxon-Rank sum test is the appropriate test for the comparison of data from healthy and depressed patients involved in the study. We are comparing independent samples without the assumption of normality in the data.
Okay. I've read the paper and I have some questions and concerns about your methodology. You briefly mentioned a flaw, that the mean and median data for the groups are significantly different, but individual data points looked very similar in certain healthy and depressed individuals for the control and experimental groups. While I agree that the Mann-Whitney test determined that there was a significant difference between the overall groups, I think that the actual data would be less useful in a clinical sense. According to an article from the British Medical Journal, Mann-Whitney test is not just a test of medians. Differences in spread can be important. Anna Hart describes how the Mann-Whitney test can oversimplify data because it does not adequately examine the shape of the original data set. The differences in population medians identified by the test often signal distinct shapes in the data sets. In this instance, the test doesn't tell us enough about the differences in spread among the subjects for the healthy and depressed groups. Is this a valid concern?
Well, while that's a valid disadvantage of the Mann-Whitney test, the clear goal of this paper was only to establish that the hand motor patterns displayed differences in their fractal pattern, not to quantify the exact shape of the data or trends among individual groups. Additionally, this still allows for hand motor patterns to be used as a treatment response measures because a depressed individual would significantly differ from the average of a healthy group in regards to fractal pattern.
And along that line, I don't entirely agree with how you chose your subject groups for the study. 20 subjects is not a large enough sample to establish patterns for healthy individuals. How can you compare depressed individuals to such a limited healthy group?
Well, so we only had 20 subjects in our study due to a very careful patient selection process in order to minimize confounding factors. We would argue that this is actually more accurate because we have more controlled factors. We know that the signals or results being displayed are due to depression in the patient and not to any other differences in demographics.
Would you consider establishing more data for healthy individuals in the future? This could allow for a single depressed patient's fractal pattern to be compared to a well-established group of healthy patients.
Right, yes, that's definitely a possibility. However, most healthy patients are consistently displaying a fractal scaling component of 1. So any deviation from this is likely a signal of abnormality. Our goal was to see if depressed patients were displaying consistent abnormality, and in this study, depressed patients consistently showed higher fractal scaling components in their right and left hand, even though their range of motion was very similar to healthy patients.
Okay. And when you talk about the single fractal component, scaling component, determined by the detrended fluctuation analysis, does this factor communicate the complexity of fractal patterns? I think that in a way, having one single value represent all of the activity limits the amount of insight that the analysis can offer.
Right, so the hand motor patterns are a very complex data set with lots of natural fluctuation. And so using this metric was an effective way to simplify that data and communicate that hand motor activity shows fractal patterns similar to gait that was affected by depression.
Okay. And the increase in alpha value represents a more simple fractal pattern, which would mean that overall hand motor activity has become more patterned. Did your analysis offer any insight into the pattern that the depressed individuals might exhibit? Do all depressed people show similar patterns in regard to hand motor activity?
This actually is a question that could become an extended area of research. Currently, this is the standard of measure as far as fractal patterns are concerned. For example, in a very recent October 2017 study published in PLOS One, researchers researched the impact of Tai Chi on gait health. And in this large study, they used DFA analysis to determine fractal scaling components. So it was definitely an important step in our study to establish this relationship before actually looking further into these dynamics.
Okay, thank you. I enjoyed discussing the methods of this paper with you and the patterns of hand motor activity in depressed patients.
Yeah, definitely. Thank you.